Good morning. This is a report on Keola. Keola Akana is a 70-year-old male, a patient of Ann Meyer, nurse practitioner. He was admitted with heart failure. He has no other significant medical history. He is married. It's his second marriage, and he has 3 adult children. He has no known allergies and is a full code status. Last vital signs were a temp of 98.7, blood pressure 152/92, heart rate 94, respirations 28, and SATs are 92%. We have had to increase his oxygen to 3 liters per minute via the nasal cannula to maintain oxygen saturations above 92%, and there is an order to keep them up there. He is denying any pain right now. The other medications we held his digoxin this morning because he had some concerns for dig toxicity. His toxicity symptoms are resolving. Other medications this morning included potassium, atenolol, and furosemide. He got an extra dose of IV furosemide, 40 milligrams at 12:30 for a low urine output overnight and today. He has a right 20 gauge ACIV. It is just saline, locked with saline. There's no fluids running. He's on a regular low sodium diet, up ad lib, standard isolation precautions, and has a high fall risk. Neurologically, he's been intermittently confused. His confusion seems to be worsening throughout the day. His heart rate is irregular with an extra S3 sound. He's managed with digoxin. He has 3+ pitting edema in his lower extremities and in his lungs. Urine output has been low. Yesterday evening, he voided 220 milliliters in 8 hours. Overnight, he voided the same, 220 milliliters in 8 hours. Today, he has voided 350 milliliters in 7 hours, after both having the oral and IV furosemide. His last bowel movement was yesterday, and bowel sounds are present. His skin is intact. He gets dyspneic at rest. He ambulates reluctantly with the assistance of one because he gets very dyspneic. He appears more anxious this afternoon. His wife, Zoe, is in the room with him. She is very nice and helpful. Labs were drawn this morning when the nurse practitioner suspected a fluid imbalance issue. They have been reported in the EHR, but I have been so busy that I haven't had the time to review them. Please call her with the labs. He is stable but having some kind of fluid balance issue. Our plan of care is oxygenation, medication, and lab monitoring, and call the nurse practitioner with lab results. Oh, and keep the SATs above 92%.